As we talk about the face, we consider the upper third, the mid third, and the lower third. And the lower third is really a problem because as things start to droop and sag, people don't like what's happening. And that might be jowling, marionette lines, double chin, wrinkles on the neck, sagging in the neck. And these can be all addressed in many different modalities. Filler in the cheeks help lift the jawline. Filler can be used along the jawline, along the marionette lines to lift and bring volume back to the chin. We can fix an asymmetrical chin with filler. And so these injectables are great for addressing that kind of concern. The fat under your chin is a totally different issue, and Kybella is an injectable product that dissolves fat. It is a chemical that naturally occurs in our body that dissolves the fat we eat. So we're injecting with a series of small sticks into the under chin fat area to dissolve the fat. The treatment takes only a few minutes. There is a little bit of stinging, so we use ice, and then patients are quite comfortable. The important thing about Kybella is that you will have swelling afterwards, and the swelling usually starts to develop within a couple of hours and may last for 2 to 4 or 5 days. You'll notice it more than the other people around you. However, that first 2 or 3 days, you should expect to be wearing a turtleneck, a loose scarf, or be aware that you'll have a lot of fullness. People will call and say, I look really bullfroggy. And I'll say, yes, that's normal. You can use ice, you can use Advil, Aleve, over-the-counter products, but it really is going to run its course regardless of what you do. And what you're seeing with that swelling is your body's natural inflammatory reaction in response to the death of the fat cells. In other words, this is what comes in to clean out the debris. Afterwards, we do wait 6 to 8 weeks, even up to 12 weeks before we do a second treatment. We're finding most patients need between 1 and 3 treatments to get the results they're looking for. And we're using between 1 and 2 vials as we're treating, depending on the amount of area. What we're trying to accomplish and what Kybella does for you is by removing the fat in this area, the skin is going to retract so that you have a less fullness from the front. People call it their baby fat chin. Often patients will say that people think they've lost weight when that fat is diminished, and a nicer contour and profile from the side. So Kybella, I think, is a marvelous non-surgical tool with really very minimal downtime. You just need to plan accordingly to take care of an area that's quite common. And this is a genetic problem. It doesn't matter if you're thin or heavy. If you are genetically prone to have fat in this area, there's not much you can do about it. What we find with Kybella is that patients tolerate the procedure very well. They know to expect some swelling and they're planning their life accordingly. And when they come back after the first treatment, we're often seeing improvement after that very first treatment. And we're typically, again, depending on the volume of fat that we're trying to diminish, may do a second and sometimes even a third round of sessions. It is okay to space them farther. Sometimes because of social activities, people won't do their treatments on a regular program, and that's fine also. There are exciting new advances with Kybella coming down the road because due to the inflammation that Kybella causes, we're seeing retraction of the skin of the neck, which is a very difficult area. And we're looking forward to hearing from the Kybella manufacturers about that in the near future.